back, everybody. Once again, we're here at Mind Hijack, and you're wondering, what's with the beard? It has nothing to do with isolation and being in a room. I thought I'd try something different. You know, I figured that a beard might make me more inspirational or maybe more motivational. It doesn't matter, but just in case you're asking, no, I have not been hiding in a room in isolation and quarantine. This is something new. Which brings me to the next topic. Today we're going to be talking about panic attacks and panic disorder. You know, a lot of people don't understand the difference, yet it is one of the number one presentations to doctor's offices. Many people often go to doctor's office expressing symptoms of palpitation, shortness of breath, dizziness. It's almost like they're having a cardiovascular event. They almost feel like they're having a stroke or they're having a heart attack. Many people will show up to the emergency room for these reasons, and often after they do a complete workup, including an electrocardiogram, laboratory findings, they don't see anything, and then they begin to question some of the things. A panic attack, let me describe what it is. A panic attack is an event that suddenly out of nowhere, you could be walking, sitting, watching television, and you have no conscious idea what's going on, where suddenly your heart begins to race very fast. It is sometimes associated with an episode of dizziness, as if you're going to fall down. You begin to lose your breath, your skin becomes prickly like electricity is going on, and sometimes you can lose your balance. You may also have developed a GI condition. This panic attack is the nervous system, what we call the autonomic nervous system. It is the system that normally tells you there's danger, but if you look around, there's no danger, other than your wife telling you, hey, stop eating on the couch. That's not the real reason to get a panic attack. A panic attack can tell you it comes from a situation where you're simply walking and doing daily activities. It is so severe that you feel like you're dying. In fact, many people will say, I think I'm dying. Help, help. And these panic attacks can last as much as 3 to 10 minutes. It is so worrisome that ambulances sometimes are called. Now, the problem with these panic attacks, when they're associated with the older people, you have to worry and you have to make sure you're not having a heart attack or a stroke. So normally these things subside. You go to the emergency room, they do an evaluation, they don't see that you have thyroid disease, that you don't have a heart attack. They sometimes have to do an MRI and you don't have anything. And suddenly you get the consultation by the psychiatrist in the emergency room and it turns out that you had a panic attack. That's what a panic attack is. You know, a panic attack is almost like this hallway, like you're going through this hallway and things are just moving away from you and you get dizzy and fall down. A panic attack may mean that something is going on inside of you when it appears again. So what's the difference between panic attack and panic disorder? Normally, panic attacks don't have to be treated with medications. Panic attacks could be an indication that you're basically drinking too much Red Bull. That's one thing that can cause it. I'm telling you right now, if you're one of those Red Bull people that gulp down 10 of them and you have a panic attack, there's your problem. Believe it, first-time cigar smokers, yes, those cigars have a load of nicotine, and that can provoke a panic attack. Certain coffees, anything that has caffeine, or any chemicals that can be stimulants, and sometimes you have to be very careful. For those who like to lift weights and go to the gym, yes, there's something called a pre-workout drink. In fact, those pre-workout drinks tell you very clearly, be very careful, start with a scoop. But I know those guys are really honcho, they think they can do it. They pop one of the big scoop and they feel like they're dying. By the time they make it to the gym, they're puking and they want to die. That's a drug-induced panic attack. So those are the things that we look for. Normally they don't come back. Normally it's an indication that you took something or you thought of something. Panic attacks, believe it or not, can be caused also for those people who like to play video games at night and they don't sleep for 3 days. A panic attack could be provoked by lack of sleep. Panic attacks can also be provoked by thoughts. Panic attacks, for example, we're living in this apocalyptic, almost like dystopian world. People are reading so much into all these things that are going on, and believe me, there's a lot going on. I mean, how many will you disagree with me? Everywhere you turn, there's either this big hornet that's about to kill you with this big sting, or the big Saharan dust is about to come towards you, or basically the weather is so hot that you're afraid of hurricanes. The media, the things that you see can provoke a simple panic attack, okay? These things that that can provoke images in the brain that will activate your nervous system. These are things that can do it. Those are understandable, and those are usually treatable with, hey, let me take a step backwards. I think I'm doing too much of this. Those are treatable. Those you don't worry about too much. However, when these things come back again, one after the other, usually three, now we're going into panic disorder episode. That is much more serious intervention. You know, people say, I don't want to take medications. Well, okay, you can, because panic attacks are caused by irrational thoughts or a thought that is misunderstood as something. For example, one of the things that panic disorders are triggered by a scent. If that scent was associated by seeing a dead dog when you were little and it scared you, anything that has to do with foul odors will provoke a panic disorder. For example, you can have one episode after another, and those things don't stop. A panic disorder, if you have 3 or more episodes within a period of time, that's constitute now a disorder. You can be gung-ho and say, hey, I can deal with this, I am going to meditate. But probably the better thing you can do, meditation is good, it might help, but there's no guarantee that it's going to work. The best thing you can do is see a cognitive therapist. A cognitive therapist helps you reconstruct your thought processes so you can stop the cue. For example, sometimes a panic attack can be provoked by this long tunnel. So you people with panic disorder, I hope I didn't provoke it, but I'm trying to explain that sometimes tunnels can provoke panic disorder. Sometimes a mall can provoke a panic disorder. When you're moving to a huge place, sometimes people can provoke panic disorder. And you know it again, the media, what you're watching on television can provoke panic disorder. The problem is that you have to stop it, because untreated panic disorder, what not to do. For those people that think that alcohol, I take a glass of wine every night. Yes, it will treat your panic disorder, but guess what? It is not the best medication, because you better buy a few bottles of wines, because to treat panic disorder takes quite a few bottles, and by the time you drink 4 bottles of wines, you need to visit me for alcohol dependence. So that's not the best way. And by the way, panic disorders are associated with substance abuse. They're associated with usually marijuana, usually associated with marijuana dependence and alcohol. And for those people who have those cards, yes, you go to the guy with the card for the marijuana, that is not the best way to treat panic attacks. You know, I want to remind people once again, marijuana, there's very little research to tell you that is effective with anxiety disorder, pain disorder. Yes, I'm sorry, my colleagues, you need to hear this. Assuming you take this marijuana, what happens with marijuana, yes, it alleviates the anxiety. Hell, it's like marijuana will alleviate anxiety for everybody, but there's a problem with that. What you fail to realize that you keep taking it and anxiety keeps coming back. And sometimes it can come back even more sinister, associated with paranoia, like somebody's behind your back. Now you have anxiety with paranoia. Hey, I'm telling you, marijuana, there's no clinical trials. The only benefit I see for marijuana right now is people with cancer disorders, people with problems with certain types of epilepsy. Let's move on. The next thing you want to do is you have to stop panic disorders like a snowball. Imagine the snowball rolling down. It gets bigger and bigger. You try to control it. You may have only 3 panic attacks, which will have maybe one of these episodes per month. When these episodes begin to be almost like every week, you can't function. Imagine you're driving the car and suddenly It's spinning. You can get an accident. Imagine you're at home and you start tipping over with a panic disorder. It has major problems and it does interfere. I will give you my trade secrets as to how I treat it, okay? And this is where I'm going to start opening up about how I treat people. One of my secrets is that in order to destroy anxiety, you have to shut it down. Remember, it's a big snowball that keeps getting bigger, bigger, and bigger. The idea is to shut down the snowball. So how do I decide that only one medicine eventually is needed? The question is, does this disease can last for a long time. However, it has been shown that treating panic disorder with cognitive therapy, the therapy that teaches you how to think this through, with medication, you may have some success in not taking anything within 1 year. Yes! So this could be easily treated with 1 year, provided that you have eliminated all the stressors in cognitive therapy. You have a very high success rate. Now, let's go back to the atypical antipsychotic. You know, they look at me kind of strange. What is this doctor giving an atypical antipsychotic with somebody with anxiety? I think he's losing it. You see, so you want to give this just small doses. I'm not going to tell you that one, which one it is. That you have to come to my office and I'll show you. It is treatable. You don't have to suffer. Do not use marijuana and do not be brain hijacked into using alcohol. Your own brain hijack. You think you can self-medicate, and this is where alcoholism comes in. People use alcohol to kill anxiety. Well, I hope this was educational today. And don't forget to like and subscribe down here, because I have more coming for you in the weeks to come. I will be providing you with new information, including new studies and new treatments as part of this program. We're going to change this beast into something better. Enough for the pandemic. Let's bring some positive light, and it's time for doctors to start giving to people their trade secrets so their patients can benefit from you. Once again, like and subscribe. It's been a pleasure seeing you again, and I will see you next time.